Medicine Science Society. So I was a part-time student, full-time employment. The first year I was working at Dept with client, and the second year I was working at Merck, which is another pharmaceutical company. I was working at clinical trials. I don't know where to begin. I think maybe just a little bit of my journey from what I was doing at King's and to what I'm doing now. So in the first year I took part in the King's College postgraduate business plan competition called Lines Then, and I won that. I also ran for student council in the second year, and that was really enriching experience. After my degree I worked for a consultancy firm, IMS Health. We consulted with the likes of GSK, Pfizer, on those acquisitions, business strategy, that kind of thing. And then after that, for 2 years, I worked for a policy in the public affairs consultancy, and now I'm working with the NHS on this massive program called NHS Change Day. I'm not sure if anybody's heard of it. Oh, yeah, someone said they've heard of it, but that's really good. So it was on the 3rd of March. It's the biggest social movement in the NHS, and I was really proud to be part of that. And that would have been possible without the sort of degree and the things I've learned there. My first degree was pharmacy, so I already had a clinical background, but this MSc allowed me to transition from sort of hard clinical knowledge to being sort of respected as a think and someone who could sort of take current thinking and some current knowledge and apply to something practical. I'm trying to think what else was to say. So also outside of work, I'm also part of a political think tank called the Fabian Society, and that's sort of on the left of the spectrum. But again, I've also had great input into sort of health ministers, Labour health ministers, and sort of sharing my thoughts. And again, that wouldn't be possible without this to not only help me shape my argument, but also to be able to take other people's philosophies and ideas and to distill it into something relevant for today. I knew that I had to transition from being sort of frontline clinical worker to someone that could, have ideas and policy and big picture things. So this, spoke right to that. In particular, a lot of the modules I picked, and like Richard said, the qualitative and quantitative research methods, and all the other extracurricular activities that I took part in were pivotal to being able to transition from effectively a pharmacist to sort of a young, rising sort of policy thinker now that I think I am, going towards. So that was the main reason. And then again, I can't speak highly enough of the opportunities at King's, being in London, being a prestigious university that it is. The business plan competition was great, the student council was good, but it is the effects that King's has on my CV, if I'm being blunt, about the opportunities I have with a consulting firm and other sort of other work opportunities, and even the things I'm doing in the NHS now. It's opportunity at this university.
Any questions for Adi?
What do you find most difficult when, because obviously people with quite a rigorous scientific background and the way that you're trained, what did you find most difficult in the transition to sort of a more artistic discipline and way of writing?
Being confident that my opinion was just as valid as philosophers, centuries ago, and that as long as I knew how to express it coherently and critically, then it could be respected and it could be published. I wasn't lucky enough to have my work published, but that was probably the most difficult. That in some of the other sciences, it's 1 and 1 equals 2, but here it's a lot more expressive and it's based on your opinions and your own theories. So it was having the confidence to do that. And also then, I guess, the way that you have to apply yourself, that if you really want to get the best out of it, you've got to read around the subject and, go out of your way to find other journals and other theories that will supplement your line of thinking. Not to just dismiss it because you can't find it, but to really, go in it, because in pharmacy and biomedical science and that kind of thing, textbooks are generally the same, red blood cells, generally the same in the textbooks. So it was learning how to apply myself in that regard and just having confidence as well.
So sort of like during the course, how was the balance between looking at say the philosophical theory and then
Well, with this program, this one was very current. So, for example, I remember, looking at the construction of ADHD as a disease, and that was, I think, the last sort of 70 years. So that was quite current. There were other things that were really quite current. So it wasn't just, things that were quite distant and maybe not things that you could relate to, but things that were really quite current. Because I was working, full-time in pharma. I could always go back to work and see how these things were expressed. So I was working in clinical trials unit, GlaxoSmithKline and Hammersmith, and just seeing, just going into work and seeing how we're attracting people to take part in these clinical trials, and then going into lectures on Wednesday or Thursday and understanding the mechanisation of the body and things like that. It was really relevant. Does that answer the question? Theoretical perspectives of the pharmaceutical industry and how it's analysed. I think because there's some tension between what authors can say about it, and although you've got your Ben Goldacre who looks at bad pharma, that's quite a radical author. But I remember because there's issues around sponsorship and the black box of pharma as an industry of its own. I look at generally how sociologists, philosophers have been analysing the industry. It was along those kind of lines. And although I worked in the pharma industry or consulting for 2 years, it was always helpful because at times, I remember I was at Congress in Vienna, ESMO, which is European Oncology Congress, whatever, and there were times I was speaking with clinical leaders or key opinion leaders from your Glaxos and Pfizers, and I would remember this stuff that I was talking about in my dissertation, and it would make me look half knowledgeable. And sort of help me go through the conversation. So really relevant. Almost every module, optional module dissertation has been relevant to my working life, and even outside. So like I said, for example, extracurricular activities is with the Favored Society, and they're really sort of helping develop theories and political ideologies on the left. And stuff like this gives me the confidence to, even if we didn't tackle a particular subject in the module, I have the skills now to go on Scopus or German websites and research current thinking. I don't think I would really struggle to think of another course or department that would give me the confidence. Also, to echo what Richard said, just in terms of personal relationships and the time that the faculty have for you was really important in developing my confidence there. Because although I'm not put my hands up to it, it's gifted to have my stuff published, the staff were really inclusive and really brought everybody along. So that was really helpful. So talking about dislikes, I think there were a number of students on the course who were I'm not sure how the system worked at King's, but they were a bit younger, and I think they were halfway through their medical degrees, and this was like an option rather than a master's course. I'm probably not expressing that right, but I think the younger students seemed not to, and because they weren't in work and perhaps couldn't see how the theories could be applicable to modern work situations, maybe it was harder to make the jump from these theoretical things we're discussing to having to be applied in the real world. And I think in terms of answering the question what they might have disliked, it's seeing its applicability to what kind of work can they get, and because some of them that did do the masters, the younger ones that finished this masters, either went on to do PhDs or still stayed in academia or went on to do another masters. So I think perhaps not appreciating that you can apply these theories and the skills you learn to modern work life as it was. Because I worked for as corporate as you can get, consulting firm. So maybe that's the only thing I can think of.
So, as you may have seen also from Hannah's course, we do a lot of interactive teaching and learning, and not everyone likes that, although generally, please correct me if I'm wrong, most of our students like that very much actually.
Yeah, I mean, and to answer the question sort of coming from the pharma or pharmaceutical sciences to sociological sciences, I think personally one of the things that was quite difficult for me was getting essays back and your opinions being critiqued. So although I said that I have the confidence now to express what I said and have confidence that I'm right, in your chemistries or biologies or physics, if you get an equation wrong, someone can say definitively this is why it's wrong. But when you express yourself on a piece of paper, you put the vowels into it, and then someone says that's worth a certain grade, that does take a while to process. And then because it's not structured lessons to say this is why you did wrong, you have to go away and read and develop yourself. It can be a learning curve to then get to that point where you are confident enough to reevaluate where you went wrong and then get the confidence to say, no, this is what I need to do to reach that grade. So many things that I've been doing since I graduated that would not have been possible without not only the factual knowledge but the soft skills that I've developed outside of the course as well at King's, and like I said, the confidence. So I would like to wax lyrical about Change Day because it is such a great thing that's happening in the NHS. Basically, if I just run a bit on it. So Change Day is like a red nose day for the NHS. It was the 3rd of March, so just a couple of days ago. And I was up in the Healthcare Innovation Expo, NHS Expo in Manchester. And I was going all around the country making sure this Change Day message was spread. If anybody wants to check it out, it's changeday.nhs.uk. It's an official Change Day program. It's basically trying to get change model into the NHS. As a theoretical model for change, it's quite prestigious. It won a Harvard Business Review and McKinsey Award in Innovation, and it's really cutting edge, like happening now kind of stuff about how you get grassroots frontline movement in the NHS and how you encourage people not to seek permission of the bureaucrats but just to make change themselves. And it's happening now, and I wouldn't have been involved with it if not for this stuff that I've got here and the confidence and the rest of it. So,
thank you so much.